Okay, I'm going to demonstrate how to do a rectal suppository now. I have come into the patient's room. I've used my hand sanitizer. Hi, Jane Smith. Let me check your wristband. Yes, and what's your birth date? Okay, that matches what's on your MAR. And I am going to put on my gloves. Now, Mrs. Smith, I'm going to be giving you a rectal suppository, to help relieve, to get your peristalsis moving and just try to help relieve any discomfort you're having. One thing I want to do first is to ask, if you're having any discomfort in your GI or your stomach area or any discomfort in your rectal area. And after I've assessed all of that, and she said, no, I have some bloating, and then I'm going to help assist her into the left sideline or left Sims position. I've already gone ahead and I've placed a waterproof pad underneath. Okay, and I'm going to now once again double check my MAR and my physician's orders to make sure that the doctor has ordered this rectal suppository, and make sure that my suppository is the right dosage for this patient. I want to make sure it's the right dosage, the right route, the right time, the right patient, and I want to make sure all my 5 rights are covered. Then I'm going to take, I'm going to use the suppository in my dominant hand and take the lubrication in my non-dominant hand, and I'm going to make sure the tip of the suppository is well lubricated. And I'm going to have already assessed the anal area to make sure that there are no abnormalities. And then I'm going to go ahead and I'm going to ask the patient to make sure she's comfortable. I'm also going to make sure that I ask her to take slow, deep breaths and try to relax her anal area as I'm going to go ahead and insert the suppository. So can you please go ahead and take some deep breaths and just try to relax. And I'm going to hold her anus open, and I'm going to insert the rectal suppository at least 4 inches. And then I'm going to hold her buttocks together, and just ask her, please make sure that you try to keep that retained in there. We're going to leave it in for at least 5 to 10 minutes if we can, and make sure that that medicine gets distributed how it's supposed to. Then I'm going to take a tissue and I'm going to wipe the anal area and put the tissue down there, and I'm going to take my gloves off. Now I'm going to make sure that I document that I did in fact give the rectal suppository. So I'm going to document that on the MAR with my initials. And now I'm going to make sure I come back into the patient after about 5 to 10 minutes and check on them and ask if you're having any symptoms, or if you need to use the bedside commode. I've got one here, or a bedpan. And I'm going to make sure that I've kept that patient covered. I don't have a bath blanket out here right now, but I'm going to make sure that this patient is covered except for just the anal area that I'm going to be using, or exposing to give the suppository. Okay, the next thing that I'm going to do, and I'm going to leave the patient in the left Sims position, because now I'm going to go ahead, this is a different patient, and I'm going to go ahead and administer enema. Okay, so I'm doing the same stuff. I've done my pre-steps. I have, made sure that the same or the right route, all my 5 rights of medication, the right drug, the right patient, the right amount, the right time, the right, I can't even think of them all right now because I'm too busy putting my gloves on, but I'm going to make sure those 5 rights are all covered. I'm going to check again my MAR, my doctor's orders, check against the Cardex. I'm going to make sure all 3 that this is what the doctor has actually ordered. Okay, I'm going to identify my patient again, and I've already prepared the solution in here, and I've got it all ready. I've explained to the patient what we're going to be doing, that we're going to be doing an enema to try to relieve some, I gotta get this out of the way, try to relieve any stool that's backed up, or just help with some of those problems. I've got my bedpan handy. Once again, I've got my pad underneath to collect any soiling. I have gone ahead and asked about any allergies, any gastrointestinal problems that they might be having. I've gone ahead, covered the patient except for the rectal area, and I am making sure that the patient is going to be relaxed again and breathing slowly. I'm going to explain that I'm going to be doing this procedure, and I'm going to, once again, I'm going to be having this hung up somehow, but I'm just going to hold it myself right now. I'm going to lubricate the end very, very well. The solution in here that is going to be between 100 and 105 degrees Fahrenheit, because if it's too hot, you're going to burn the patient. If it's too cold, you're going to go ahead and cause a lot of cramping for the patient. I'm also going to go ahead before I do any before I insert this, I'm going to make sure I get all these air bubbles in here, because if we have those in there when I go ahead and do this for the patient, that too is going to cause a lot of cramping for the patient, and it's not going to be very comfortable. So I'm just going to make sure I get all those air bubbles out. Okay. Now I'm going to come over, and I've already got the tip lubricated too. And I'm going to go ahead, this is going to be hanging, of course. So then with my non-dominant hand, I'm going to be opening the area, exposing it, and with my dominant hand, I'm going to go ahead and I'm going to slowly and gently, as I'm having them take a deep breaths and relax, try to relax their anal area, I'm going to slowly insert the enema. If you can come over and see, slowly insert the enema 4 inches in, and I'm going to be going in towards the umbilicus, and I'm going to make sure that I do it slowly so that there's not a lot of cramping too. And then when I go ahead and start instilling this, I'm going to let the tubing go off just really, really slowly, because I don't want to, if you get it going in too fast, that's going to cause a lot of cramping, and it's going to be a lot of discomfort for the patient. So I'm going to go ahead and release the tubing, or release the lock just very gently so it flows really slowly. And if the patient ever complains of any cramping, then I will stop the, I'll either crimp the tubing, or else just use this little lock and go ahead and slow it down. And then also, like, you're going to have this hung like 12 to 18 inches above the anal area, and just lowering it down and then rising it up again is going to help slow or control that flow. And the same with taking and crimping off some of the flow too is going to do the same thing. So then when the patient, if we need to stop at all, I'll do that and let them take a breath, a few deep breaths through their mouth, and try to relax until the urge to defecate is passed. Otherwise, I'm going to try to instill the whole bag, if it's enemas till clear, or as much as the physician recommends. Then when it's done, I'm going to slowly withdraw the tube back out, place that down on the pad, and then I'm going to take that tissue again, and I'm going to wipe their anus, and then I'm going to, kind of ask them to tighten their sphincter up, and I'll kind of try to hold their buttocks together. And we're going to want to leave it, for 10 minutes if we can. Hold it in as long as they can. Make sure when I leave them, so they can have some privacy, because you know, this is something that they might just want to be by themselves, leave a call light in their reach so that they can call me and just say, Mrs. Smith, please give me a call on the first urge to defecate. And then have a bedside or bedpan handy and a bedside commode, and come back in and check on the patient. And make sure if they go to the bathroom, either in the bedpan or the commode, that I want to make sure I want to see the results so I can see what kind of a result we've had. And I would have taken these gloves off at this time too, and come back in and then I'll document all of this after that. Yes, indeed, I did give Mrs. Smith her enema. She did receive it. Document that and document all the results.